Good morning. Today is March 8th, 2023. My name is Emily Williams. I'm the director here at the Bridgewater Senior Center, and we have a fireside chat today with Leslie Barbosa, a Bridgewater resident who is very, very kind, very open-hearted, and very devoted to helping others of all ages. Leslie has lived in Bridgewater for many years. She's the founder of Josie's Village, which is now a nonprofit entity. Yay! She's come a long way. She's got some wonderful business skills, wonderful board of directors, and a lot of support from Kathy Hayes and myself in the Senior Center to try to match senior citizens here in town, as well as in West Bridgewater, to companions, friends, someone to reduce the loneliness and the isolation. And we're very proud to have her here today. And she's going to be sharing video and some photos of her tour last month, I think it was, or in January.
January now.
Went up to San Diego, California, and hopefully enjoyed some sunshine and went on from there. So welcome, Leslie.
Thank you so much, Emily. It's wonderful to be here with all of you and share a little bit of my journey, which has brought me to today, I guess. So I suppose I need to start at the beginning because, you know, everything has a beginning. And my beginning started on November 18th, 2009, when my mom, Josie, was diagnosed with vascular dementia. Soon after, the diagnosis of Alzheimer's came along. And then actually after her death, I did discover that she also had Lewy body dementia. So when she was diagnosed, some people will say, well, you have to think about, what decisions you're going to do, what type of care they're going to have. I was told she needed 24-hour supervision. So in that moment, I really didn't have a choice. I knew that I needed to take care of my mom full-time at home. So I closed my business as a personal chef and moved her into my home and cared for her for 11 years until her death in February of 2020. So just before the pandemic. It was quite the journey, when I first started caring for her, the social worker she was at a rehab after a bad fall, suggested I reach out to Kathy Hayes at the Bridgewater Senior Center because she ran a caregiver support group. I came to that group every single minute I could. There were times that it was impossible for me to get there, but it really helped me to get through the next 11 years of my life of caregiving for my mom. That first year was very difficult when I didn't have the caregiver support group. And I reached out to the Alzheimer's Association when I was having, I didn't know anything about dementia. I always said I knew less than nothing. And it was the Alzheimer's Association during that first year who really guided me and helped me along so that it wasn't so terrible. I do remember that I was feeling suffocated and overwhelmed, and my mom was feeling the same way. And what could I do to help her? And all the experts said, don't take her out in public. Don't take her out to restaurants. Don't take her to the mall. Don't travel with her. And this was really hard for me. And I knew it was hard on my mom because these were all things that she loved to do, to be out with people and, enjoying life. And it wasn't until I went to see an otoneurologist for her, she was having dizziness. And he said to me, he was looking at her brain MRI, and he said, yeah, she definitely has Alzheimer's and vascular dementia. But, do everything you want to do with her. One thing I will tell you is that there are more memory cells in the heart than there are in the brain. And that was like a light bulb going off for me. So I knew then that I needed to do as much as I could to keep her happy and active and social. And so that's what I did. From that day forward, we traveled, we went, every day we were out doing something. And she went to a daycare program a couple days a week, which was really helpful. It gave me a little bit of a break, but it also gave her, time to socialize with people who were in her same situation. And they were wonderful. She went to New England Sinai, and they were just amazing with her. So it really took a village for me to get through the journey of caregiving for someone with dementia.
Gina or Kathy, do you have any questions or comments about how it all began? Because I know the community can relate to this.
I wanted to mention that Josie, actually, one of the things that Leslie did to keep her mom active was deliver Meals on Wheels for us here at the center.
Yes, I did. Yes, we did. Yeah, that was a lot of fun. She was my co-pilot. So, it was early on in the disease. So she could still, read, and she would tell me, where to go. And she was very excited because, I would deliver the meals, and I would tell people who I was, the elders I was delivering meals to, that I had my mom out in the car. So they would all wave to her, and she'd wave back. It was just really lovely, and a nice way for her to feel like she was volunteering and helping others, doing things for others, which she loved to do all her life.
What a great idea to stay social. Meals on Wheels.
Meals on
Simple, easy, comfortable, but you're still giving back and finding purpose for the community.
Right, exactly. It was wonderful, and yeah, so it's hard to break down an 11-year journey of caregiving to just a few minutes, but looking back on it now, there was like, I would think like the first few years was really difficult because, I felt like I was giving up so much of my life to take care of her. And so, my husband would go to family functions, and I was feeling just so sad because I couldn't go, because I had to take care of my mom. And she couldn't go to these kind of larger functions as she was progressing in the disease because it would, bring on anxiety, and she'd be nervous. And I was taking her out of her environment, which is never a good idea for someone with dementia. So we would stay home, and, I would make the best out of every holiday. And then, kind of midway through our journey, I started to feel a little bit neutral about it. I was like, oh, okay, it's okay. My husband's going to this. I'll hear all about it, and wonderful. And then I would say the last 4 years that I cared for her, which she was on hospice also for the last 3.5 years of her life here in my home. And my whole attitude changed, and I started to think about how sorry I felt for everybody else who didn't have what I had, because that bond from caregiving just brings you together so much. But also when you're caring for someone with dementia, it's just a little bit extra, I guess, is the way I explain it, because there's just, they depend on you at that point. She was in end stage Alzheimer's or dementia for, 4 years. So she depended on me for everything. So it was really kind of wonderful to come that full circle and see how far I had come in my journey with her. And, thinking back on, 11 years before, how sad I was that I couldn't go to Thanksgiving dinner with my husband's family. But then I'd look at my mom, that last Thanksgiving, and I was so happy and so grateful that, I had this and not many people have what I had. So, yeah, it was a wonderful journey. Privilege, really.
Absolutely. And
Yeah.
it's so important. I'm hanging on every word that you're saying because so many other caregivers can relate to you, identify with you, whether they're a man or a woman, a son or a daughter or a grandchild. Each caregiver's journey is so unique and so special, but you are absolutely right. When there is a diagnosis of Alzheimer's, dementia, or some other related disorder with our memories,
Right.
it's heartbreaking. But the good thing is there's a lot of money going into research to try to prevent the early onset, the progression of the disease, and there's so much more available for the community.
Right.
Kathy Hayes is one of the resources. Forget about the senior center. It's Kathy Hayes.
Yes, she is. Right. She is.
About meeting with her for a minute or two or a full hour, or attending the caregiver support group, which happens every second and last Thursday of the month here at the senior center from 10 till about 11:30, 12 o'clock, depending. And it's for people who are struggling with care, the role of a caregiver. And it's a very, very welcoming group as well.
It certainly is. I could not have gotten through those years without that caregiver support group. And I feel privileged now that I'm able to come and to that support group and offer assistance to other caregivers who are, somewhere in that journey. I can relate to the entire journey from the beginning to end. So yeah, it's nice to be able to give back in that respect, so that did Kathy and the senior center did so much for me, along my journey. Yeah. So.
And now you're a resource through Josie's Village to connect the community, the senior center community, the senior community, as well as the caregiver community, to your volunteer program. If you could talk about that.
Yeah.
And let me know when you want me to show pictures.
You can show pictures whenever you want.
Okay.
But yeah, so Josie's Village came about. So as I mentioned earlier, my mom's name was Josephine, but we all called her Josie. And what she loved most was when my friends would come to visit her. Like I said, she was a social butterfly. She was funny, she was witty, and she just enjoyed my friends so much. So, my husband, of course, family would come to visit, but my friends, it was just, she missed her own friends, I think. And so they would come to visit. And even when she was very late in the disease, she would turn to me after they left and she would say, "Friends are the flowers in the garden of life." And, I would just, it would just melt my heart. So after my mom passed, and of course I was in grief, and, I'd done a few things. You had reached out to me, Emily, about doing a cooking show for seniors while everybody was in the pandemic. And so did that, which was very rewarding because I know I was helping people, make a little bit better choices in what they ate. And but Josie's Village, so it was November 2020. And I woke up one morning thinking about the seniors in our community and how lonely and isolated they must be feeling. And so I reached out to, Emily and Kathy, and we, and I asked if there was any kind of program where we were matching up seniors and volunteers who might be feeling a little bit lonely and isolated. I know that there were programs, like the Pen Pal program and, maybe at Christmas and different things, but I was looking for a year-long program, and you said there wasn't. So, fortunately, you said, yes, let's do this. And on February 11th of 2021, Josie's Village was born. And like I said, and Emily said, we match up seniors in our community with volunteers, and it is truly just to build a friendship, whatever that friendship means. We have now about 30 or so volunteers here in Bridgewater and the West Bridgewater Council on Aging, and where we match up people and to develop these friendships. And it's just so incredible to sit back and watch these friendships develop. And like I say, it's all, each friendship is different. I want it to be, organic relationship. A friendship between Emily and I would be different between a friendship between Kathy and I or Gina and I. So, it's whatever that friendships develops. So so that's what we're doing. And last year, well, later in 2021, after Christmas, I knew that I needed to grow the program because I knew that there were lonely seniors, not just in Bridgewater, but in all communities. So I started working with 2 SCORE mentors, and what they do are they are retired executives who help you to build a business. Now, I've built a business before, but not a nonprofit. So this was something new. And of course, I had been out of the workforce for years, taking care of my mom. So I work with them to, write my business plan, write the protocols, everything in order to, get Josie's Village moving along and towards a nonprofit. So right now, we are now incorporated, and I have my board of directors, and Kathy Hayes is the chairman of the board. And so now we are working on the nonprofit status with the IRS. So that's where I am with Josie's Village now.
How do you go about signing up for the program? What's the process of getting that special companion matched with a senior, or if you want to be a volunteer, how do you do that?
Right. So I love Facebook and because, you can reach so many people. And, we have a great Bridgewater residents page and of course my own page because, people followed my journey with my mom and were inspired by it. So I reach out on Facebook looking for volunteers. And, that's how we started. And now it's still doing the same thing, but it's becoming a little bit more word of mouth as well. So what we do is so I set up an interview with the potential volunteer with Kathy or with the outreach coordinator in each senior center. So if someone reaches out from Bridgewater, I would set up a meeting with Kathy and myself, and we have an in-depth interview. We really get to know the potential volunteer, what they like, what they dislike, if they have any kind of barriers, in regards to, the senior population. And based on that is how we look for seniors. And of course, for me, I know seniors in the community, but I don't know seniors in the community like Kathy Hayes does, or, the West Bridgewater Council on Aging, so it's the perfect relationship for me, because Kathy knows the seniors. And I actually just recently started an intake form that for potential participants, and, where they can say, okay, here are my hobbies, this is what I like to do. And then based on hobbies, likes, dislikes, that's how we match up our volunteers with our seniors, because we want to have a base where this friendship can grow.
It always warms my heart when I see the senior who's in Josie's Village and then their companion and their volunteer. And there was two here yesterday, just having a sweet treat and a cup of coffee, and conversation. And it brought such joy because of that social aspect, which is the heart of why you started Josie's Village for your mom. That social piece is detrimental to their health. When you think about it, it gets them out, it gets them in a familiar environment, the senior center. They may have come here, years past, but it's such a wonderful opportunity for them to be engaged again,
Right.
which doesn't always happen. I mean, but Kathy takes calls every day of people who are so isolated and they do not feel comfortable leaving their home because they don't have a ride, they don't have any means, or they're just not comfortable with their memories and they're
Right.
forgetting things, and it's not comfortable for them to be out and, talking to people. It's embarrassing. So
Right.
when they have a companion, it's like a breath of fresh air. They're back to their old selves.
And I'd
Sure.
like to say with that particular match, Emily, that was exactly the case. It was the daughter who reached out saying, my mom is such a vibrant person and she is sitting home all day alone by herself, because the adult child, she had to work. She had family to take care of, try her best, to get mom out, but she just wasn't always available. So that's how that match began. It was the adult child reaching out saying, please help me, get my mom in a situation where she can be more engaged and more social, because that's what she loves. So yeah, and it does warm your heart because they come quite often to the center.
Yeah, I'm jealous because, I don't get to see it. I see it every once in a while, and of course, Josie's Village now, we're starting to do social gatherings, and which, Emily let us have one, this past summer. We had an ice cream social, and it was just so wonderful because, I'm seeing, these friends coming in, just enjoying their time together. We're all having ice cream sundaes. I mean, how can that not be a great day? And one of our participants, who is actually now the oldest participant, and she said to me, she was just so grateful to be there. She said she used to come to the senior center for years, but hasn't for so long. And, but now here she is today and she gets to see her friends, and it was just, you know it just solidifies, the reason why I wanted to build Josie's Village and, hopefully take it out to the world. So not just in Bridgewater and West Bridgewater, but, to others, because there are so many lonely seniors out there who just need a friend, who can, bring them to the senior center like they did, like this one match did yesterday. That's everything to me, because my mom would have loved that. Yeah. So,
And the other thing too, I wanted to mention, if anybody's watching the recording, I've bumped into a handful of people that are out in the community and they are visiting with somebody in the community and helping them out. And I always, let them know about Josie's Village, because if they want to do it under Josie's Village, then I think there's a lot of benefit to that. Like you mentioned, Leslie, with the social gatherings, with the Christmas extravaganza. I mean, there are a lot of benefits to being part of the Josie's Village program. So if anybody's watching and they are assisting a neighbor or an older adult in the community, consider connecting with us, so that you can become part of Josie's Village. Because Emily just showed a little tiny piece of the Christmas extravaganza.
Right. That was actually a sampling of the gifts that each one of our seniors got this past Christmas. So that was the day of, the wrapping party, where all of our volunteers come and choose their gifts for the seniors. And once again, this is a community effort right here. I reach out to the community asking for gifts for our seniors. And this year we had thousands of gifts. It was truly unbelievable. And so all our seniors get lots of gifts for the holidays, which is just so wonderful. And that was another thing I wanted each one of our seniors to feel like a kid on Christmas morning. And I was getting notes, after the first year, that's exactly how I felt. This is a picture of one of the ladies who brought gifts. Right there, she made 30 gift bags. They were like soup bags of gifts for all our seniors, where she had different types of soups and crackers and just an assortment of things. And she wrapped each one for each one of our seniors. So that was really amazing. And what is also wonderful about this photo is this woman in particular, Janice, her mom is one of the participants in Josie's Village. So I was thrilled when Janice brought her mom with her to my house to drop off these gifts. So it was wonderful.
What about the men? Sometimes we take calls, or folks come in, or we hear through the grapevine that there's a man who recently lost a spouse, or is just not coming to the ball games anymore, or is just not leaving the house. How would you help a gentleman like that through Josie's Village?
Yeah, so we absolutely have men who are part of Josie's Village, and it's wonderful to see. We actually just recently matched up a new volunteer with a new participant, and it's just incredibly, we were thinking about one other volunteer to match him up with, but then we learned that this participant, it was his daughter who reached out, and actually his sister as well, who I know had reached out to me about Josie's Village, that he was feeling lonely because he had just lost his wife about 3 years ago and was having some health issues of his own and couldn't get out really and was really feeling lonely. And so we matched him up with this new volunteer who I do actually know, but we got to know even better when Kathy and I met with him. And we matched them up specifically because they both enjoyed sports. So and it's been a great match. It's only been about a month, but I did receive a message recently from the volunteer that, they had gone out for dinner and had a great time. And so, like right there, just right there, that simple going out for dinner, right, is something that is so important to all of us, because you're getting out, you're amongst people, you're with your friend, and you're having a good time. So just that 2 hours that they went out for dinner meant everything to the volunteer, but it also meant everything to the participant, who was a man.
Thank you. Are you looking for donations for like baseball tickets or restaurant gift cards or anything like that where the volunteer can, instead of taking it out of their own pocket, go that route? Are you accepting donations?
Well, I think that this, because we're not a legal nonprofit yet with the IRS, so I could probably take things in kind, or they could donate them to the senior center, at this point. Yeah,
Thank
I don't want to get in trouble with the IRS.
You can always go through the senior center because it supports the senior community. If anybody out there wants to give a gift card or a movie ticket or a taxi cab ride, if the volunteer doesn't drive, we are happy to connect that to the volunteer and senior need for sure.
That's
The
wonderful.
last part is your summit for today's chat. If you could talk about your summit, and I'll throw some pictures up on the screen, and it looks like you had a really great time.
Yeah, so the summit, so it was called the Alzheimer's Association's Community Leaders Summit. And so after my mom passed away, I knew that I wanted to give back to the Alzheimer's Association. So I started my first walk to end Alzheimer's. And that was in 2021. So I've had 2 walks so far, and we are Josie's Journey. And we do the South Shore Walk, which is in Plymouth. And this year it's October 14th, 2023. And if anyone wants to join my walk, but that's a picture of my first team. And we had a lot of fun raising money, and it's just an emotional day. So because I am outspoken, I guess, and I do like to share my journey and bring awareness to dementia and Alzheimer's, that I was just overwhelmed when the Alzheimer's Association invited me to their summit, which was in January, the end of January in San Diego. So how could I say no? San Diego in January, right? No one's going to say no to that. So yes, so at the summit, yeah, so that was the welcoming sign. We were at the Hyatt in San Diego, and there was myself and about 1,200 of my closest friends. And so, which was a little overwhelming, but there were people from all over the country there. And I felt like I was with my tribe because, they were all so passionate about finding a cure for Alzheimer's. We are now in an era of treatment, which the president of the Alzheimer's Association, her name is Dr. Joanne Pike, mentioned in one of her speeches. And it was just so amazing to hear that, because we have never in the history of Alzheimer's have heard that, an era of treatment. We've had medications in the past. My mom was on them, which will help with symptoms, maybe, and but now we are seeing more treatments coming down the pike. The problem is, well, the great thing is the FDA is approving them. The problem is Medicare is not paying for them. So, which is a real problem, and part of our advocacy as volunteers with the Alzheimer's Association is to try to get Medicare and Medicaid to pay for these potential treatments, because some of them, of course, may only help with early onset, or the earlier stage of the disease. But those people, it could be really helping those people right now. And Medicare and Medicaid are denying paying for those medications. So that's really, it's one of the things that we as volunteers are trying to spread the awareness about this, because, there's plenty of heartbreaking, terrible diseases out there, cancer, heart disease, but there are treatments for it. There's nothing, for Alzheimer's right now that are being covered by Medicare and Medicaid. And if you can't afford the $26,000 a year price tag, then you're not eligible, which is really just terrible,
Who is this gentleman from the summit? He looks animated.
Yes. So this man is Tony Gonzalez, and he is such an inspiration. At 47 years old, he was diagnosed with early onset Alzheimer's disease. He lives in California, and he was actually a radio talk show host. And he was, if I remember correctly, we had a lot of inspirational speakers, but I believe he got lost. He was getting lost going home and or going to somewhere familiar, which, anyone who knows anything about Alzheimer's is that's very common, in the early stages. And it took a long time for him to get a diagnosis, and but he is so inspiring. That's one of the things that just was amazing about this summit. We're seeing very young people in their 40s being diagnosed with early onset Alzheimer's disease, and they have so much hope and they are true advocates to finding a cure for this disease. And you look at Tony, who is, probably now in his early 50s, I believe, maybe 51. And he's just a young man, the prime of his life, and is now battling Alzheimer's disease. So, yeah.
That's wonderful that he can speak out about his conditions and challenges and successes. That's
Yes,
great.
absolutely, absolutely. We had another gentleman who was diagnosed with MCI, which is mild cognitive impairment, which is kind of the precursor for Alzheimer's. And, the first thing he did was sign up for a triathlon when he was diagnosed, and again, someone in their 40s, which, you don't typically think of people in their 40s as someone with Alzheimer's, but it's there.
Thank you. Thank you. We're lucky to have you around to share your journey. If it's okay, I'd love to share some pictures
Sure.
of your mother, Josie herself.
There she is.
Beautiful woman.
I used to refer to her as Queen Josephine. So in this photo, this was in 2014, so I was about 5 years into my caregiving journey at that point, and I reached out, look at all the cards, I reached out on Facebook to my friends to send her a birthday card. And yeah, it was just amazing. So I did that every year. So yeah, there she is with all her birthday cards and gifts.
She looks very proud.
Yes, yeah, she was so happy all the time.
There's another one because she had so many friends,
Mm-hmm.
and she's always she has this look on her face like it's pride and joy, and it's
Yeah.
so real.
Right. Oh, yeah, absolutely. Yes, she just was the epitome of joy. And here is my girlfriend, Deborah, and she came from Washington State to visit my mom. So she came for about a week, and, it was just amazing. Like, I had friends coming from all over to visit. Yeah, they were coming to visit me, but I was really kind of second. you know, everybody wanted to visit my mom. And yeah, it was just incredible. So here we are. Here is Friends are the Flowers in the Garden of Life, right? Right there.
Okay. And there's one more. There's so many, but they're just so beautiful.
Oh, thank you.
And then tell me when you want me to play the video. I have, it's-
Yep. Again, these are two of my closest girlfriends who, you know, my mom at this point was completely bedridden. And there she is with my girlfriend Lisa and Andrea. And yeah, you know, you can see it on her face. She's just so happy to have people coming to visit her and wanting to spend time with her. Yeah. Mhm.
um, this one is, I want to show them all.
Yeah, so that was the my first walk. It's actually behind me. You know, this big poster, they make these big posters, the Walk to End Alzheimer's. If you raise a certain amount of money, then they will make these posters. And so it's nice. So yeah, Josie's journey.
Thanks, Leslie.
But look at the joy, right? The joy in her face right there.
It's magical.
Mhm.
Let me show one more. One
Sure.
of the trade, it's almost like a trademark for you, is Woody. It's Woody.
There's the man. There's the man. So there's Woody. He's also behind me. So Woody, you know, my mom was a little bit of a jokester, as I said, you know, witty and funny. And she would tell people that she was looking for a man. And so one of my girlfriends, Carla, who lives in Arizona, she found Woody at, you know, like a toy store or Target or Walmart, and she sent him to my mom. And well, my mom was just smitten with Woody. You know, he became her best friend. You know, she would refer to him as her boyfriend sometimes, and then finally they got married. But he was to her, um, he gave her so much love and she loved him. And it was something that she could hold on to and cuddle and, you know, really bring joy and purpose to her life. I knew that, you know, if she was having, you know, because, you know, she did have dementia. So it wasn't, you know, rainbows and butterflies all the time. There were times when the dementia demon, as I refer to, would pop in. And, you know, Woody was just a calming presence because it was something for her to hold on to and love and give her security and make her feel safe. And yeah, so now Woody is a constant at the Walk to End Alzheimer's. He has his own shirt, as you can see. And yeah, so she actually went through 3 Woodies because she would pick at the stuffing. You know, of course, she thought he was real, but she would pick at the stuffing, so I would have to replace Woody every once in a while. So we went through 3 Woodies, and the first Woody, the original Woody, is actually buried with her. And I have, you know, right there is the second Woody. And the third Woody went with my mom the morning that she passed away. I um, I donated her brain to Harvard and Mass General Hospital. So Woody, I refer to him as Woody 3.0, went with her to Mass General. So I have to think that, you know, for the brain autopsy. So I have to think that Woody 3.0 is now at Mass General helping others.
He is.
Yeah.
He is. And so are you.
I
So
hope-
much, in so many ways.
Thank you.
is there any advice that you can give a caregiver just starting their journey?
Yeah. So just starting the journey, is when I say to really reach out, reach out if we're in Bridgewater, reach out to Kathy because, Kathy can help them to, get them involved in the caregiver support group there. I can't say enough about how much those 2 meetings every month helped me, along my journey. Read as much as possible about the journey. That's what I did the first year. I can't tell you how much I read because I wanted to learn. I wanted to know what was going on. If a new caregiver if their loved one is diagnosed with dementia, don't take that as a diagnosis because it isn't. Dementia is a set of symptoms. You want to know the cause of the dementia because each type of dementia, whether it's Alzheimer's, Lewy body, vascular dementia, whatever it is, frontotemporal lobe, all have their own nuances. And you really want to understand how that disease could progress. And it will only help you, as you go forward. So yeah, those are the things that I would really suggest,
Kathy, did you want to add any other resources? Or
Just the other thing that, no matter where you are, you can go on to Dementia Friends of Mass website. Excuse me, I have the same allergies, Leslie. You can go on to that website to search Dementia Friends informational sessions in your area, or there are also hybrid ones, so you could actually Zoom into a meeting. Those are 1-hour informational meetings about what dementia is, what it is not, and how to better communicate with somebody living with dementia. I think that it's a great way to gain a bit of education and also to make your community a dementia-friendly community. So we are doing one here on the 23rd at 10 o'clock. So if anybody would like to attend, there's the flyer right there. You can call us to sign up, or you can email to sign up. So.
Yeah. Also, I do want to, mention the Alzheimer's Association hotline. They are available 24 hours a day, 7 days a week, where you can, if you are in the middle of a crisis, with your loved one, or just have a question, maybe you're not in a crisis, but just have a question, call the, 800 number and for the Alzheimer's Association, and they will help you and they will direct you. And they will also, what I loved about the Alzheimer's, or still do, about the Alzheimer's Association is that they follow up. So if, I know with me, that first year, and I had reached out to the Alzheimer's Association many times, and, they would help me in the moment, but then, I would get a phone call 2 weeks later or 3 weeks later, asking how I was, or, if the situation had resolved, or, they're just a wonderful resource, the Alzheimer's Association. And, their website is alz.org.
and the phone number is 1-800-272-3900. And just like Leslie and Kathy said, it's 24/7, and it's their phone specialists are so well trained,
Yes.
and it's a great resource. Thank you for saying that.
Yes. Yes.
Well, as we wrap things up, Leslie, thank you so much for speaking and sharing, and I hope this recording helps others.